Welcome to the webinar, It Goes Without Saying, Nonverbal Communication. I'm Barbara Lewis. Thank you for joining us. This webinar is going to last about 30 minutes, and if you have any questions, you can type them in the Q&A box. If we don't have a chance to get to your question during the webinar, we will respond afterwards. But before we get started, let me talk briefly about .com. .com is a proven online interactive healthcare communication skills learning system with an interactive platform that helps learners acquire knowledge, skills, and attitudes about communication. The modules, there are 42 of them, were written by leading authors, and we have a back-end learning management system, over 400 realistic unscripted videos, and annotated interactive videos as well. We have about 90 institutions that subscribe to .com, and over 100,000 subscribers have used .com in over 20 countries. And we've been translated into 3 languages, 4 including English. There are 10 journal articles that support .com that have done studies, and here are some of them. The sister platform of .com is professional formation, and we have 12 modules plus 2 faculty modules on faculty development and remediation. And these modules are free during remote learning during COVID. And I'm going to talk how you can get these modules and have a trial subscription to .com at the end of the webinar. But now let's get started with our 3 presenters. Lori Callan designs simulations and coaches physician learners as a medical educator and standardized patient educator with NYIT College of Osteopathic Medicine in New York. Luke Fink is an organizational communication practitioner and educator. He is the assistant director of the Office of Medical Student Research at Vanderbilt University School of Medicine and an assistant professor in the Department of Medical Education and Administration. And Tara Singh is assistant professor in obstetrics and gynecology and reproductive biology at Harvard Medical School and assistant professor at Tufts University School of Medicine. She serves as obstetrics and gynecology clerkship director for that organization, that Harvard at Cambridge Health Alliance, and is the associate director for their longitudinal integrated clerkship. Welcome.
Thank you, Barbara. I know I speak for Luke and Tara to say how glad we are to be with you during this lunch hour. Thank you, lunch half hour. Thank you for taking this time to be with us to discuss this topic. So these are our advertised objectives, and also just to let you know that this work is an extension of the module Nonverbal Communication, It Goes Without Saying, that was created for .com that we were asked to work on recently. So if there's anything that comes up, if you'd like to dig deeper into this topic, we encourage you to look out for that when it is published, or of course, as Barbara said, you can reach out to us. So why are we here? The value of effective nonverbal skills in healthcare is both immediate and there are long-term benefits. So it can help facilitate natural, comfortable conversations by reading your patients more effectively, can help you navigate complicated or challenging conversations, helping to unlock mixed messages that might come up. It's really a win-win. These skills support the provider and the patient alike in developing that therapeutic relationship, which we know leads to higher outcomes for patients. So we thought we would just start with some familiar images and examples of nonverbal communication at its most basic level. Nonverbal communication is what we communicate beyond the words that we speak. So here are some images. Certainly the gesture of the hug in the bottom left corner, the hug and the smiles gives us some information about these 2 people and their relationship. The folded arms of the healthcare practitioner, while we can't see the full picture of what they are doing with their body, it is an interesting piece of information. It's a little small up here, but this picture of the football sideline certainly carries quite a few messages if you look at each person's body and try to imagine what's going on there. Of course, we have the thumbs up of this person in the upper left upper left-hand corner, a sign we've been seeing a lot. And then I actually included a little photo of my son. He was letting me know in a very crowded and noisy airport that he was good. He was keeping his N95 over his mask, over his nose and his mouth, which was a constant task for me to keep him on that. And then also in the lower right corner here, we have two people whose bodies are relaxed, but they're also mirroring each other, which gives us some information about a harmony or a synchrony in their dynamic. And then this upper right corner, the picture of the fake smile. I love the implication of this. I have a smile on my face, but we all know that this is a fake smile. So those are just some images to get us thinking about nonverbal communication. And we each come to this presentation today with years of experience with nonverbal communication. We are participating in it every day, consciously or not. We may also have different ideas about what it is. Maybe you think of it as how you sit in your chair, or maybe it's speaking with your hands or comforting somebody with a social gesture or a welcome gesture or touch. But before we continue, we'd like you to reflect on this question. What are you communicating non-verbally to your colleagues or patients? And how do you think others perceive that nonverbal communication? So just take a moment and think about those two questions. We know that you all have a lot to think about, but we hope that during this brief time together, we can provide you with some quick tools at your disposal, some more paints in your palette, so to speak, for more effective communication with your patients. And that first tool that we'd like to offer you is an acronym that we named based on 5 primary domains. So these are the 5 primary domains in which we operate. And the acronym we're presenting to you today is called KAPPE. My colleagues will be going into further detail about what each one means, but I'll point out first, because we are always communicating, we are always in a process of both transmitting and picking up information in these 5 domains. And then we're hardwired to synthesize this information and to derive a meaning from them, or derive a story. And you can look at these 5 elements really as the building blocks of our nonverbal communication. And I love this image that I came across. There are actually 5 different blocks in this picture. Who would have guessed it? And they come together to form a question mark. And it really is a great example of what is that story behind the nonverbal communication. In other words, these 5 elements create 4 patterns that tell a larger story. They are a safe pattern, fight pattern, flight pattern, and the conservation withdrawal pattern. Recognizing the elements of these patterns is so important in healthcare conversations, especially where the topics can be sensitive and complex and where time is limited. As you know, sometimes patients are hesitant to use words to describe what they're feeling, but being able to read their nonverbal communication can lead to more effective conversations and outcomes. So now I'll pass it on to my colleague, Luke, to get into the details of KAPPE.
I appreciate your framing of the conversation. That'll help us as we move forward. So as Lori mentioned, we've created KAPPE out of concentrating on these 5 primary nonverbal communication aspects. So kinesics, artifacts, paralanguage, proxemics, and environment. So first, I want to talk about kinesics. So next slide, please. Kinesics. So kinesics is body movement. These are the things that we think about when we're talking about body position, touch, gestures, facial expressions, eye contact or lack thereof. All of these things that we use to emote with our bodies are conveying messages constantly. So think about this in terms of your patient interactions. When you're delivering messages to your patients, how are they receiving that? Well, if they don't say anything, what are they saying with their bodies? Are they slouched? Are they leaning forward? That helps us understand whether we're connecting with our patients well. And I'll draw your attention to the drawing cartoon there on the slide. And I think this is very representative of a lot of our interactions these days. That states, if you can't read it, it states, your eyebrows seem more expressive than usual. So think about how we are currently in a state where our masks are covering up half of our faces and how we're having to emote outside of that. So take a second in this next reflection question and think about, what are you communicating above your mask? Excellent. So we might dive into this a little bit in the Q&A at the end. So next up, we're going to talk about artifacts. So whether you realize it or not, artifacts are these chosen tangible objects that we use to adorn ourselves, or tools that we use in our practice. And they're typically reflective of our own self-concept, who we think that we are, and the message we think that they're displaying. So think about things like your badge that you have that we often wear in clinical spaces that has our name, our affiliation on it. And maybe you have a stethoscope. Maybe you're wearing a white coat, maybe you're not. Maybe you're dressed in scrubs that day, or maybe you're dressed in more professional apparel. So all of these things are conveying messages to our patients and others about who we are and what exactly our duties entail. Sometimes we think it's conveying the right message, and sometimes it may not be. So be mindful of that as you work in those spaces. The next concept in our KAPPE is P, with pair language. So I want you to think about pair language, which I think is arguably the most fun to talk about. And I'm going to use the example clue. But when we think about pair language, go back a slide for me, Lori. We jumped. Thank you. So we think about pair language, we're talking about all the things that we use with our voice to convey nonverbally. So tone, rate, rhythm, inflection, volume, emphasis, things like that, that convey some sort of message, meaning behind what it is that we're actually saying, right? All those connotative, not the denotative elements of language. So I alluded to Clue. If you haven't seen this movie, it's awesome. I recommend you checking it out this weekend. It's a murder mystery movie, whodunit, if you will. But if we think about Clue and use the statement, I did not touch that knife, I can dramatically change the meaning depending on what word I emphasize in that sentence. So using that same sentence, if I were to say, I did not touch that knife, I seem to be implying that someone else did. If I said, I did not touch that knife, I did something to it, but maybe I didn't touch it. And then lastly, if I said, I did not touch that knife, oh, well, clearly you've touched some sort of knives, but it's not that knife. So again, I think this is a fun way for us to think about how important it is and how we're delivering what it is that we're saying and all those elements that we use in our voice to convey that message. So moving on, we're going to talk about proxemics, and I will toss that to Tara.
Thank you, Luke. So as we keep on with our KAPPE, K-A-P-P-E, we're on our second P, which is proxemics. And this is how we shape our space around us. And when we shape our space, we can be thinking about personal barriers or physical barriers. As we consider the advent of the pandemic and what that has meant, and looking at this image on the right, we've been pushed more and more to keep our distance from each other, a minimum of 6 feet apart, to prevent viral transmission. So this is definitely something that is interfering in developing our own personal barriers. And those might have existed before COVID, but this may be new and more deliberate since the advent of the pandemic. Other personal barriers include things such as vertical height difference. If you're much taller or shorter than a patient, how do you see eye level with them? Angles of facing, how do you pose your body? Lori showed that beautiful picture of the two people sitting side by side, but how do you pose your body to share and shape your space to build a relationship with the patient? Physical barriers many of us know about and have and use on a regular basis include things such as computers, desks, examination tables, and as Paul brought up in the Q&A too, talking about Zoom and virtual visits. What do those create as physical barriers to our communication and relationship development with patients? Next slide. So we have hopefully a helpful mnemonic to think about as you're using your EHR with your patients in the room. And this really deals with proxemics and sort of how we see ourselves integrating ourselves with the patient and with the tools that are around us that may or may not be movable for us. So I want to just take a second to go through this. The first, we're going to use human and level to help talk about proxemics. So H is honor the golden minute. So this is the first time you're meeting the patient. You walk into the room and you're sitting there talking to them. Try to be tech-free. Try to engage with eye contact and be with the patient in the moment. The equilateral triangle of trust. There's an image of this on the right. How do you set your computer so that you can still see your patient, and perhaps your patient can also see the computer in a nice triangular fashion so everything is open between you? Maximizing patient interaction, which goes along with, the tech-free moment and the tech-free time that we spend with the patient. And importantly, making sure that we're acquainted with the patient record before we go into the room. So before we go into that visit, rather than spending time on the computer looking at the patient chart, hopefully we've read a little bit of background and we can start right in on the conversation with the patient. Keeping eye contact. And this is really important when you're talking to patients about sensitive matters. So maybe putting the computer aside for a couple of minutes, turning and facing the patient, working on that angling and keeping eye contact. Letting the patient look on. I know sometimes this can be difficult, and especially depending on how your space is set up, but giving the patient the opportunity to look over your shoulder or share with you what's on the computer screen so they can be part of that engagement with the technology that's in the room. Eye contact we've talked about, and use the computer as a tool, again, to demonstrate things to the patient, maybe show them images or results that have come up. Explain why you're doing what you're doing. I think this is really important. Paul also brought this up in the Q&A as we think about, or sorry, maybe not Paul, another provider, as we think about perhaps patients who don't read nonverbal cues as well. We can even bring that out. We can call it out and say, this is why are we thinking about this? Why are we doing that? To help engage and develop those skills as well. And then if you have something important to tell the patient, whether it's throughout the visit or after the visit, logging off the computer and really giving your patient your full attention, filling that space so that the two of you can have that conversation regarding care. So this, I think, is a really great image. I'm hoping some of you have had the opportunity to see this image. It came out in JAMA Network in 2020 under an article titled "The Cost of Technology." So I'm going to give you a second to look at this. And what we see here is we see in the middle of the picture a young girl sitting on a table, which looks like an examination table. And to the right of that young girl are two female-bodied providers or patients or family, we're not sure, on the right side. One of them could be the mother with the baby in the background. Maybe the other person is another family member or could be a nurse even. And then behind the patient, off to the left side of the image, we see presumably the provider, and they have their back to the patient on the computer or in the chart, not entirely sure what they're doing. But this was a 7-year-old's perception of the provider-patient interaction. And I think that's fascinating and behooves us to think about, what do we look like to our patients and what are our interactions look like? Thank you, Laurie. So we're going to move on from prosemics and we're going to go to the last KAPPE, which is environment, or E. So environment is all about workspace location, as simply from how do your patients get to your location? Do they drive? Is there parking? How do they get there? And how do they get into your office space? Examination room layouts, which we've talked a little bit about, but what equipment is in your room? Are your monitors separate from you and the patient or close to you? Does the examination table sit between you and the patient, or is it in a place that's separate from where you're engaging with the patient initially? And then we also think about equipment. Now, equipment is something that may or may not be in our control. And as an example, my lights just went off in my office space. That is not in my control. It's set on a timer. And lights are really important. When we think about what the lighting is like in your examination room with your patient, is it too bright? Is it too dark? Can the patient see you? How does that impact your conversation or relationship with the patient? What about music? When you come into the hospital, the clinic, the office space, the operating room, is there music playing, and how does that sound? And what kind of setting does that give for you and for your patient for the interaction you're going to have? And finally, odors. Something we don't think about a lot is, what products do our cleaning staff use? Is it lemon scented, orange scented? And how might those smells permeate the space that you're in with your patient? So these are all important things that play into our environment. And finally, the image on the right is just to spend a minute talking about a study that came out many years ago that looked at patient perception of time time they spent with their physician. And this image reminds me on the right of the outcome of that study. So they had patients visit with physicians, and some of the physicians stand at the foot of the bed versus sit down on the bed or at the side of the bed. And what we note is that patients perceive the physician or the provider spent more time with them when they either sat beside them or on the bed than when they stood at the end of the bed. I think we have a hand raised. Maybe we want to take that question.
We've got some questions that I think we'll tackle at the end at this point, but I'll keep watching.
Okay, thank you. All right, on to the next. So we've just talked about KAPPE, which are our 5 domains of nonverbal communication. When our patients come to see us, they present in a vulnerable human state, and it may be influenced by past experiences with the medical field, past experiences outside of the medical field. And as a result, we talked a little bit about patterns and how we can see those patterns that are safe or unsafe within our domains. So we will present with patterns, as well as our patients coming to us will present with patterns. And Lori outlines safe, fight, flight, and conservation withdrawal. How we use our 5 domains to respond to these patterns that we perceive in our patients and that they're exhibiting will help to impact the patient-physician or provider relationship. So for example, when a patient is really angry with us or with the medical system, they may go into conservation withdrawal pattern. And what does that look like? So first, they lean back in the room or disengage, move back from the space where we're engaging with our patient. And second, they might start answering in one-word answers. So that shows us a particular type of pattern, and how we respond to that is important. What can we do to respond to that with nonverbal cues? One thing we could do is present with a relaxed body posture. We can make sure we're at eye contact and eye level with the patient, and try to remove physical barriers, whether that's a computer or a desk or something, so that we can engage more closely and with the patient and see how they respond to those nonverbal cues that we present. We can also call out behaviors that we observe specifically. So I noticed when I made these comments or when I said these things, your posture changed. What are your feelings about this? To bring it right to the forefront so we can have that conversation with the patient. Next, Lori. Thank you. So this is important, and we've been already seen this show up in the Q&A, but with the COVID-19 pandemic, we are adding a new layer of difficulty to nonverbal communication. You see in all of these images, the mask wearing, and in some of these images, full PPE that providers are wearing while caring for their patients. So instead, we have to focus on some more of the subtle clues that happen when we have nonverbal communication. That might be a raise in the eyebrows, as Luke pointed out, changing in eye contact, and changing in our body posture or body positioning. I still forget when I'm walking down the street and I smile at someone under my mask that they can't see me smiling, and have to remind myself, maybe I should wave or do something else so they can tell that I'm happy to see them and engage with them. So I think in this way, it's become even more important for us to learn to read nonverbal cues and learn which nonverbal cues we are presenting to our patients. So I have one provocative question too that we'll spend a couple of 15 seconds or so thinking about. How might you really engage in nonverbal communication while you're dressed fully in PPE? And what might you think after seeing this presentation? What might you do differently? Thank you. And Lori, I'll pass it on to you.
I'm going to stay on this slide because it seems to be pertinent to some of the questions that have popped up. I'm going to, let me just check this quickly. I'm going to have Luke start. I think he wanted to address one of the questions live that came in Q&A, and then we'll get to those individuals who had their hands raised as well. Luke?
In the middle of responding to one of the questions. So let me go over to, so one of the attendees had mentioned related to neurodivergent patients, particularly those on the autism spectrum, for whom nonverbal communication can be a challenge when reading the body language and what that might be. They asked us to think about how would they communicate with them. We can talk about that as a panel, and if anybody has more expertise in that area, please chime in. I'm not an expert in that area. However, I would say that as we talked about in the module, which I encourage you all to check out, we talk about mirroring and how important that is in making connections. So sometimes when we see patients or others make a gesture with their bodies or shift in their position, if we are able to mirror that, sometimes we see that and that tells our brains, oh, this is somebody who's trying to connect with me. Whether you're doing it consciously or unconsciously, sometimes we just do that out of conversational habits. But if you can think intentionally, how can I connect with this person who may or may not be understanding what it is I'm trying to put forward, and can I mirror what they're doing to try and make that connection? So that would be my first thought, but I'm open to hearing anybody else's thoughts about that.
Luke, I would just jump in as well that you may, in conversation with somebody who's neurodivergent, who may not be able to read your body language, you are still able to read their body language. So being more aware, broadening your horizon of all the ways that their body may be communicating on a subconscious level will inform your it might inform your posture. It might inform the words that you speak. So what's so beautiful about nonverbal communication is that it both what we're perceiving changes and what we're communicating changes. So this is really the onus may be more on the provider to perceive their behavior and make verbal adjustments in order to accommodate the person they're speaking with. While I'm here, I have the raised hand from Lavanya Pasupuletti. I'm going to allow you to speak, Lavanya. Would you like to ask your question?
She has already answered. I'm fine. So I think I did it accidentally. I'm very sorry about that.
Excellent. No problem. It's nice to hear your voice. Somebody's out there. That's great. All right, Luke, was there another question that you wanted to address?
I've tried to respond in the Q&A. So if you're able to see that, feel free to peruse that. There's one mentioning, does tattoos fall under artifacts? If so, would the definition need to be tweaked? So yeah, the quick highlight of artifacts was by no means comprehensive. It is everything that you can think of in terms of how we adjust and present ourselves physically, things like tattoos, earrings, the way we wear our hair, whether or not we wear maybe a headscarf or a special necklace or a pin or a lanyard that indicates we're supportive of a group or want people to get vaccinated or donate, or all of those things that we do to kind of convey some sort of message using those tangible objects. And I realize tattoos don't really fall in the idea of tangible unless you're actually touching someone's body. But essentially think about it from a standpoint of what are we doing to adorn our bodies or put on our person to convey that message. It's a good question.
There's
there's another one about telemedicine. And I did respond to this in the Q&A, but I think that's a great question. So all the things we talked about can easily, I think not easily, but can be translated to a virtual platform. So I will tell you, I'll give my trade secret away. So when I did lectures this year, I used this little sticky note that has eyes and an arrow, and I point that at my camera. And that's just to remind me that that's where my focus needs to be in order to have eye contact with my audience. And so I think you've all seen presentations or been with colleagues who are looking over here the entire time. And maybe that's because on Zoom, that's where their panel or person is focused on the camera. But if you can shift that so that it's focused on the camera, I think that provides a sense of eye contact, a connection that we normally wouldn't have using a camera. The other thing to think about is how close you are. So Tara talked about proxemics. So, and we kind of joked about, we could present at the beginning of this talk, this close feels extremely awkward. So think about the distance between you and your camera, as well as gestures, right? I'm a person that talks with my hands. So if I can gesture and explain that way, it feels a little bit more natural and less disconnected that I think often we can feel using computer mediated communication. But again, all the things we talked about, proxemics, the sound, the lighting, all of those things are going to influence that communication and that relationship that you're having, even over Zoom.
Thanks. Luke, I wanted to add, I just wanted to add in too that what's behind us also is a presentation of who we are and where we're coming from. And so important, like what are you showing behind you in your scene when you're having this conversation with in telemedicine? I think we're learning a lot more too as we go through about tools such as Zoom, Meets, Teams, all kinds of different platforms, and they have lots of different things where you can blur out your background, or you can put something, your emblem from your school or your institution at the back as well. So you might want to think about how you present yourself, not just your face on screen, but what else is in the room with you.
So we actually have 1 minute left. It looks like it's just coming up on 12:30. There was one more question about nonverbal communication in the COVID era. And this is something that the three of us have been talking about. We've actually been working on this module since I think April 2021, maybe? We first started working on it, and things have changed even since then. So one of the thoughts and questions that we had was, how is this going to, how has COVID impacted our perception of nonverbal communication, how we communicate? Are we becoming more attuned to eyebrows than we used to be? Are we becoming more attuned to shoulders and body stress and body posture than we used to be with this, with masks and distance? Has distance helped us see somebody's body more fully, being able to stand further back? So there are some considerations to make in how this will affect our younger people who are growing up with masks and in this kind of less frequently being touched, et cetera, et cetera. But I do think we have to stop there. It is 12:30. I'm going to pull up. Let's see, I'm going to just fast forward to, actually, you know what I can do? I can just leave my screen. And then, let's see. Somebody said language development in children will be an interesting study. Yes, it will. So thank you.
Thank you so much. This was just absolutely fantastic. What a lot of great information. And thank you to everyone who has joined us today. The recording and the PowerPoint will be on the .com YouTube channel shortly. And please contact me if you'd like a trial subscription to .com, no credit card necessary, or if you'd like a free subscription to Professional Formation. And there is my email address at the bottom. Thank you, everyone. Really appreciate your attending this so informative webinar. Thank you.
Thank you, everyone.